about the patient.
Yes.
Complaints, whether it's in a chart in the long-term care. And when I start explaining this to them, they're in awe. They look at me and say, wow, that's a great thing. And more people need to have that done. So that's part of the whole process. It's shame on me, because what we were doing in the long-term care industry, helping the elderly over all these years, for the past 22 years that I've been doing it, and some people have been doing it longer than I have, 35 plus years, or the 49, was it 39? 49, what's our birthday? 39 years. Some people have been doing it that long.
Wow, yes.
And nobody knew it was available. Nobody knew it was around. So shame on us for not getting the word out. That's part of this 2011 campaign, is to get the word out and let people know that this service is available. It's available through our group, the American Society of Consultant Pharmacists, where you can make contacts and find a senior care pharmacist. But that doesn't mean that your community pharmacist that you go and see in 3 or 4 times a week, or maybe less, or maybe more, can't help you with some of those same problems. But to get a true, thorough evaluation, you would almost need to go to someone, at this point anyway, that has been doing that and has some experience in doing it. That doesn't mean that your community pharmacists, many of them, the students coming out now are well equipped to do this, and many of the other pharmacists are also well equipped. It's certainly a service that's available. It should be provided to as many geriatricians as we can. It's needed, and this particular part of the population is extreme risk for very many medication-related problems.
So if I'm, I guess we'll use the popular term Joe the plumber, and I'm the older guy. Okay. All right, and you know, and we're having problems. I should demand or expect my pharmacist to be able to take care of me concerning my medication and communicate with my physician. I should expect my physician to be receptive to my pharmacist, to work together as a team.
Absolutely.
Absolutely. The collaboration, or again, what we see in the future of pharmacy is that pharmacists will be part of that clinical team, as they are in hospital settings now. Physicians and pharmacists do rounds together, and it's very common. And so pharmacy students coming out of pharmacy school today are used to that collaboration. And so we need to build on that, the knowledge base that we've developed in nursing homes and hospital settings, and we need to bring it to the community, because the fact is that the vast majority of seniors, the vast majority of people over 65 live in the community.
That's right.
And we need to make sure that we're reaching out to those seniors, working with senior centers and other organizations that serve the senior population, and helping seniors understand that how to take their medications, what the medications are doing, what the risk factors are, helping them become empowered so that they can work with their pharmacist and their physician. We need to reach out to the pharmacy community to support pharmacists and the use of pharmacists' clinical skills as a way to improve patient care and quality outcomes. We know there's a lot of studies out there that show that if pharmacists are involved in patient care, we end up saving money. It's not that we're paying $200 million because of all these problems, but actually getting pharmacists involved in patient care saves money. One study looked at 104 different studies, and the author concluded that spending $1 on a pharmacist for pharmacy services will result in $16.70 worth of savings. Now imagine, I mean, look at what we spend on healthcare in this country. So we need to get this issue, we need to get medication issues under control. And again, we're just not where we need to be, and ASCP is working hard to raise this issue so that we get more people looking at the problem and understanding we need to do something about it.
And we're so excited about you guys, because we see you guys focusing more than anything on the practice of pharmacy and the value to the community, to those patients, and being able to foster that. So pharmacists can be that person that can raise their hand and say, hey, come to me, I can help you. And the patients have to demand, say, hey, give me some of your time.
That's true. You know, we've talked about this earlier too. The practice of pharmacy is really changing. There's been a lot of changes in the last several years. Technology is changing. Even the training of pharmacy students. Now it's a 6-year degree. When they graduate, they are doctors of pharmacy. And American Society of Consultant Pharmacists sees a lot of students. We have students who come to our offices as interns, and they really do, they're leaving pharmacy school with a high level of clinical skill and commitment to patient care, which is very, very exciting.
Wow, it's all about the patient.
That's right.
And so, LaQuan, now tell us a little bit about this this program that you guys will be having.
Well, this is a great partnership that we're having with the ASCP program.
Okay.
And what it's doing is we are inviting senior citizens as well as the caregivers to attend a 1-hour workshop at 2 locations.
Great.
And what it's doing is it's helping them to learn how to better manage their medication. I think I need to say that again. To better manage their medication,
yes.
and also to understand that to understand the risk of the medication problem. So that's what we are doing. We are partnershiping together to bring forth this important information.
So you're there representing the community to bring everybody together.
Yes.
For this great convention. That is so awesome. We're just excited to have you guys. We just have a few more minutes so we can go one by one, and start with you, Charles, right into the camera and give that take-home message.
First of all, I want to thank you for having us. Thank you very much. I guess the message I want you to take home is that seniors, geriatric patients are at risk for a lot of medication-related problems. You need to know that there are people out there who can help. There are pharmacists out there who can help. If you need that help, if you or someone you love has medication-related, or you think they have medication-related problems, then you can contact American Society of Consultant Pharmacists, and I'm sure Claudia can give you that number, or you can contact the station here, and you can locate a senior care pharmacist in your area or in your state. And don't think that it's related to just that area of New Orleans, Baton Rouge, wherever. We can do it, deliver it from wherever we are, and they can put you in touch with people who are capable and ready and willing to help you with your medication-related problems.
Awesome. Go ahead, LaQuan.
And what I would like to do is just inform you about the location of the events. One will be held at Central City, 2101 Phillip Street, and the other one will be on the West Bank, Arthur Mundy Senior Center, and that will be 1111 Newton. And if you need further information about this wonderful, terrific, informative information, you can call 821-4121. Thank you.
Awesome, LaQuan. Go ahead.
Thank you so much. The American Society of Consultant Pharmacists is just thrilled to be coming to New Orleans for its 39th annual convention. And what Campaign 2011 is really about is taking our message to the street. So not only are we doing the 2 programs from the senior centers, we're also going to be doing a presentation to students at Xavier University on November 18th, and inviting those students back to the convention, as well as extending an invitation to New Orleans community pharmacists through your pharmacy associations to join us November 19th, 20th, and 21st at the Morial Convention Center to learn more about senior care pharmacy and how you can make a difference. Thank you so much.
That is so awesome, really, all of the information, because again, people just don't know. When you think about medications and these little pills and these little liquid bottles, and people really they have no idea what they're taking. I mean, how would they know? How would they know but that there are people that are there to help? And I think even from the pharmacist standpoint, for a group that's concerned about the practice of pharmacy, concerned specifically about pharmacists and their relationship to patients purely as consultants, I think that means everything in the world. So November, we can go over those dates again. November 18th is at Xavier University, am I correct?
That's correct.
November.
We have a noontime presentation there. And then we have the 2 events at the senior centers the same day.
The same. Everything is November 18th.
Yes.
Okay. And what time of the event?
It's at 10.
10 o'clock at Arthur Mundy.
Arthur Mundy and Central City.
Arthur Mundy and Central City.
Yes.
And Arthur Mundy's right on the West Bank, am I correct?
Correct.
That's right. And then Central City is in Central City. That's the easy one. We can do good with that. That is so awesome. So hey, I'm your host, Chris Sylvain. We're excited that you're here with us. We appreciate you. Health Issues 2010. Come back with us again. We appreciate it.